Clostridium. The genus Clostridium consists of anaerobic spores forming gram-positive bacilli. Most species are saprophytic, found in soil, water, and decomposing plants and animal matter. Some of the pathogens, example Clostridium tetani and Clostridium perfringens, are commensals of the intestinal tract of human and animals. The genus contains bacteria that causes three major diseases of man: tetanus, gas gangrene, and food poisoning. The Clostridial pathogenicity is mainly due to the production of a powerful exotoxin. The Clostridium botulism is a non-invasive. Clostridium tetani is slightly invasive, and Clostridium causing gas gangrene are not only toxigenic but are also invasive. The most species of a genus are motile with a peritrachous flagella except Clostridium perfringens and Clostridium tetani type 6, which are non-motile. All Clostridia are non-capsulated with the exception of Clostridium perfringens and Clostridium botricum. The Clostridium perfringens, Clostridium welchi. Clostridium perfringens is the most important and common etiological agent of gas gangrene. Clostridium perfringens also produces food poisoning and necrotizing enteritis in man. Morphology: it is a large, short, gram-positive bacilli measuring 4 to 6 micrometer into 1 micrometer with the subterminal spores. It usually occurs singly or in chain, and it is pleomorphic. It is capsulated under non-motile culture. It grows on bread, agar, cooked meat broth, and thioglycolate broth within 24 to 48 hours. It is anaerobic, and the optimum temperature for growth is 37 degrees centigrade. On bread agar, the colonies of most strain shows as a target hemolysis resulting from a narrow zone of complete hemolysis and a much wider zone of incomplete hemolysis. In cooked meat broth, the meat pieces turns pink but are not digested. The biochemical reactions: Clostridium perfringens is predominantly saccharolytic but also have a mild proteolytic actions. Gelatin liquefaction: in litmus milk, the lactose fermentation leads to the formation of acid which changes the color of litmus from blue to red. The acid coagulates the casein, and the clotted milk is disrupted due to the vigorous gas production, and this is known as a stormy fermentation. Classification: Clostridium perfringens produces a list of 12 distinct toxins, but on basis of productions of 4 major toxins: alpha, beta, epsilon, and iota. These are classified into 5 types: A to E. Type A causes gas gangrene in man, and sometimes the type A produces enterotoxin which causes food poisoning. Naegler's reaction: the Clostridium perfringens is grown on egg yolk medium in a plate. To one half of the plate, antitoxin is spread on the surface. The inoculated culture plate is incubated at 37 degrees centigrade for 24 hours. The colonies on the half plate without antitoxin will be surrounded by opacity, while colonies on the other half with antitoxin shows no opacity due to the specific neutralization of alpha toxins. Alpha toxin lecithinase C splits lecithin into phosphoryl choline and glyceride lipid. The lipid deposits around the colonies, resulting in opacity. Reverse CAMP test. This test is similar to the CAMP test for the identification of group B streptococci, except that the Clostridium species is inoculated in place of Staphylococcus aureus, and a known group B streptococcus is used. Diseases: gas gangrene, food poisoning, necrotizing enteritis. Laboratory diagnosis: diagnosis of gas gangrene must be made primarily on chemical ground, and laboratory only confirms the clinical diagnosis. The specimen includes exudates from wound, necrotic tissue, and muscle fragments. And direct microscopy gram stain smear gives a presumptive diagnosis. Culture: the specimen are inoculated on fresh and heated blood agar and cold meat broth. Growth in cooked meat broth is a subculture on blood agar plates after 24 to 48 hours. The blood agar is incubated anaerobically for 48 to 72 hours. The most strain produces beta hemolysis on blood agar. The bacterial isolates are identified by morphological, cultural characteristics, and biochemical reactions, and reverse uh, CAM test. Toxicity of strain can be done by animal pathogenicity. Animal pathogenicity. The growth in cooked meat broth is injected into a healthy guinea pig by intramuscular routine. The animal dies within 24 hours. A control animal protected with antiserum prior to the test is also included. Prophylaxis surgery, antibiotic, passive immunization with anti-gangrene serum, hyperbaric oxygen. Clostridium tetani. The Clostridium tetani is a causative agent of tetanus. It is widely distributed in soil and intestine of man and animals. It is ubiquitous. Morphology. The gram-positive slender bacilli measuring 4 to 8 micrometer into 0.5 micrometer with a spherical terminal spore giving the bacilli the characteristic drumstick appearance. It is non-capsulated and motile except Clostridium tetani type 6 with peritrichate flagella culture. It is an obligate anaerobe which grows on ordinary medium. It can grow well on cooked meat broth, triangular broth, and blood agar. The and blood agar. In CMB, the growth occurs as stability. The meat is not digested but becomes black or prolonged incubations. The bacilli produces a swarming, thin, spreaded film growth on blood agar. On horse blood agar, they produces alpha hemolytic colonies, which subsequently develops into beta hemolysis due to the production of hemolysin, tetanolysin. The biochemical reactions, the Clostridium tetani has a slight proteolytic but no saccharolytic property. The gelatin liquefaction occurs very slowly. Toxin, Clostridium tetani produces two distinct toxins, tetanolysin, hemolysin, and tetanospasmic neurotoxin. The tetanus toxin specifically blocks synaptic inhibition in spinal cord. The toxin acts presynaptically. Disease. The tetanus develops following the contaminations of wound with Clostridium tetani spores. The spores of infection may be soil, dust, or feces. Laboratory diagnosis. The diagnosis of tetanus should always be made clinically, and laboratory tests are done only to confirm it. Laboratory diagnosis may be made by demonstration of bacilli by microscopy, culture, or by animal inoculation. Specimen generally collected or wound swab, exudate, or tissues from the wound. Microscopic gram staining may be gram positive bacilli with the drumstick appearance. Culture. The specimen is inoculated on freshly prepared blood agar and incubated at 37 degrees centigrade for 24 to 48 hours under anaerobic conditions. Clostridium tetani produces a swarming growth. The specimen is also inoculated in cooked meat broth and incubated at 37 degrees centigrade. The cooked meat broth is subcultured on blood agar plate daily for up to 4 days. Gram staining smear from the culture shows typically gram positive bacilli with the drumstick appearance. Toxigenicity test. The pathogenicity of the isolated organism is established with the demonstration of toxin production. The cooked meat culture is injected into the root of the tail of one mouse test animal and also into the another animal control that has received tetanus antitoxin an hour earlier. In positive cases, the test animal develops stiffness in the tail. The rigidity proceeds to leg on inoculation side, the another leg, trunk, and forelimb in that particular order. Death occurs within 2 days. The control animals does not show any changes due to the neutralization of toxin by antitoxin prophylaxis. Available method: surgical, antibiotic, and immunization. The tetanus is preventable disease. Active immunization. The tetanus toxoid, formal toxoid, is commonly used for active immunization. 3 doses of 0.5 ml of tetanus toxoid each are given intramuscularly with an interval of 4 to 6 weeks between first 2 doses and 6 to 12 months between the second and third doses. The full course of 3 doses confirms immunity for a period at least 10 years. A boosted doses of toxin is recommended after 10 years. Passive immunization, the human anti-tetanus immunoglobulin 250 units is used in prophylaxis. Combined immunization, in non-immune persons, it is ideal to immunize with first dose of tetanus toxoid in one site along with the administration of HTIG in another arm, followed by the second and third dose of tetanus toxoid in the monthly interval. Clostridium botulinum causes a severe form of food poisoning named botulism. It is widely distributed, saprophyte, and found in soil, animal manure, vegetables, and sea mud. Morphology: it is a gram-positive, non-capsulated bacilli about 5 micrometer into 1 micrometer motile by Petricus flagella and produces a subterminal oval bulging spores. Culture: it is a strict anaerobes and can grow on ordinary medium. The optimum temperature for the growth is 35 degrees centigrade. Commonly used media or bread agar and cooked meat broth. The colonies are large, irregular, semi-transparent with a fibrated border. On bread agar, the hemolysis around the colonies is observed. Classification: 8 types A, B, C1, C2, D, E, F, and G have been identified on the basis of their antigenetically distinct toxin. Clostridium botulism forms a powerful exotoxin. It is a neurotoxin and acts slowly. The toxin acts by blocking the production or release of acetylcholine at synapses and neuromuscular junctions. Death occurs due to the respiratory failure. Disease: the food-borne botulism, infant botulism, and wound botulism. Laboratory diagnosis: the diagnosis may be confirmed by demonstration of bacilli or toxin in suspected residual food or in feces. Demonstration of organisms: the smear made for the suspected food or the feces are examined by gram staining, which may shows gram-positive sporing bacilli. The culture is done on bread agar or cooked meat broth. The growth on culture medium may be confirmed by gram staining. Toxin in culture fluid may be demonstrated by toxicity test in mice. Demonstration of toxin to mice or guinea pigs are injected with unheated fibrate. One of them control is protected by the polyvalent botulism antitoxin prior to injection. The third animal is injected with the heat filtrate. The test animal unprotected develops dyspnea, facid paralysis, and dies within 24 hours, whereas the control animal protected remains healthy. The animal injected with the healthy heated fibrate also remains free of any toxic symptoms. Clostridium difficile. Morphology: it is a long, slender, gram-positive bacilli containing oval and terminal spores. There is a tendency to lose its gram reactions. Toxins: enterotoxin, toxin A, and cytotoxin, toxin B. Disease: antibiotic associated colitis. Laboratory diagnosis: demonstration of toxin. The toxin can be demonstrated in the feces by its characteristic effect on human diploid cells and HEP2. The ELISA can also be used for demonstration of toxin. The toxin is specifically neutralized by Clostridium serdeli antitoxin. Isolation of bacilli: the Clostridium difficile can be grown from the feces of patients with a subsequent test for toxigenicity. The cycloserine, cefoxtin, fructose agar is a selective medium to isolate the organism from feces. The Clostridium difficile colonies appears yellow due to the fructose fermentation.